I hope you all enjoy it. As David mentioned, today's topic is the new 1500 form. So, before we get started, let me tell you a little bit about myself. My name is Dr. Kotlar. I'm a chiropractor. I'm certified in CPT coding. I'm a certified professional compliance officer. I write articles for Chiropractic Economics and Dynamic Chiropractic. I'm a member of the ACA, American Academy of Professional Coders, and I speak for the Coding Institute, Parker Seminars, on behalf of Discount Medical Supplies, and then for many state and national association conventions. So, there is a new form. The new form, version 0212, replaced version 0805. Now, the new 1500 form, some people still call it the HCFA form, which is no longer necessary. HCFA, HCFA stands for Healthcare Financing Administration. Well, HCFA is now CMS, Centers for Medicare and Medicaid Services. So some people call it the HCFA form. Some people call it the CMS form. Some people just call it the 1500 form. You know, there's a lot of terms for the same form. But whatever you want to call it, this form is developed and maintained by the National Uniform Claim Committee, NUCC, not the federal government. Again, the 1500 form, the Universal Health Insurance 1500 form, is developed and maintained not by the federal government, but by the National Uniform Claim Committee, NUCC. The website for this committee is nucc.org. A lot of the information that I'm going to be sharing with you today comes from NUCC. So let's get right into it. This is what the new form looks like. You should see it on your screen. There have been quite a few changes that have occurred to the form. So we're going to break the form into two parts. Let's just go and talk about the top portion of the form right now. The top portion of the form is the basic patient information. The bottom portion of the form is the billing information. So the top half of the form, the first 13 boxes you should see on your screen. We're going to start going through these boxes. In the top left corner, there's a QR code. If you take out your smartphone and you scan that QR code, it'll take you right to nucc.org. So let's begin with number one. Box number one. You should see on your screen box number one. The top box number one is the old 1500 form. The new is in red. The new 1500 form is in red. So you'll see box number one, very minor changes. Basically, we're not calling it Social Security numbers anymore. They're ID numbers. Okay, let's go to box number 1A. See on your screen, 1A, that's the insured ID number. Okay, pretty straightforward. Box number 2, patient name. You think that would be pretty straightforward, right? Well, according to NUCC, if the patient's name is the same as the insured name, that's in box 4, then it's not necessary to report the patient's name. But hold on, everyone. If your software, and it probably is, right, automatically printing the patient's name in box number 2, just leave it alone. What NUCC is saying here is if the insured name in box 4 is the same as the patient's name, then you don't have to put the patient's name in box number 2, but just let the name appear in box 2 is what I say. Number 3, date of birth. Number 4, insured name, as I just mentioned. Number 5, the patient's address. Well, same situation here. Box number 5, patient address. According to NUCC, if the patient's address is the same as the insured's address, then you don't have to report the patient's address. But as I mentioned, if your software is automatically populating the patient's address in number 5 and number 7, that's okay. Just leave it alone. So that's number 5. Number 6, patient relationship to insured, pretty straightforward. Number 7, the insured's address. Number 8, we have a change. The old form, box 8, you had to designate the patient status, single, married, employed, full-time student, part-time student. The new form says reserved for NUCC use, so just leave it blank. Number 9, it says other insured name, 9A, other insured policy number. 9B, we have a change in 9B. The old form, you had to put the other insured date of birth and sex. The new form, 9B, says reserved for NUCC use. Same thing with 9C. It's now reserved for NUCC use. The old form had you put the employer's name or school name. Box number 10. Same as before. 10D, a little different here. Box 10D. The old form in box 10D, it said reserved for local use. The new form says claim codes, also reserved or designated by NUCC. So just leave 10D blank. Box 11. Insured group policy number. 11A, insured date of birth. 11B, that changed. The old form had employer's name or school. The new form, leave it blank. It's designated by NUCC. 11C is the insurance plan name or program name. 11D. 11D is the same, new form, old form, but I just want to go over this with you. 11D says, is there another health plan? Medicare, and I'm sure most other insurance carriers would agree to this, Medicare says that providers need to make a good faith attempt to find out from the patient if there's another insurance plan that'll pay for the services. So, is there another health plan? Yes or no? If no, move on. If yes, then you have to go and complete items 9, 9A, and 9D. Box 12 is the authorization to release information. Now, do you have a good quality health history intake form? If you do, this information is built into that form. So if you have a good quality health history form and the patient signs off on it, then in box 12 you could put signature on file. Remember this, I know this might sound silly, you cannot write signature on file unless you really have a signature on file. So if you don't have a good quality health history form, or you have a good quality health history form, it just doesn't include the release of information, then you're going to have the patient sign the 1500 form in box 12. Same thing with box 13. This is the release of medical payments to you, the provider. Do you want the payments coming to you? Then you should have 13 signed, or if you have good quality health history and other initial patient paperwork filled out, then you probably have that in there. Patient signs off on having the authorization to assign benefits to you, then you could just put signature on file in box 13. If you don't have a signature on file for that specific item, then the patient should sign box 13. Okay, now we're moving on to the bottom half of the box. Boxes 14 through 33. This is what you need to fill out in order to get paid. Very important. So let's start off with box 14. Box 14, one of the major changes to the form occurs in box 14. The old form, date of current illness, injury, last menstrual period. The new form, yeah, a date is also required, but you need to put a qualifier. So the date could be either 6 digits or 8 digits. and that's the first date of the injury. So let's say the patient's in a car accident on October 15th. They were in a car accident. You're going to put October 15th in box 14, and then you have to add a qualifier. There are two choices. It's either 431 or 484. We're not going to use 484. That means last menstrual period. We're going to use 431. So on the bottom of this slide, you'll see of what that box should look like filled out, the date of the accident, the injury, and then the qualifier is 431. Any questions on this? Please feel free to type them in, hit send, and we'll get to them at the end. Let's go to number 15. Little change here to number 15. Number 15 says other date. So the old form said if patient had same or similar. New form says other date. So in this case, you're going to add the other date, 6 or 8-digit format, and then there's another qualifier. First the qualifier, then the date. So the qualifier, 454. So just to give you an example, to make it a little bit more practical, patient's in a car accident on October 15th, but they don't come to see you until November 15th. So the qualifier is going to be 454, which means the initial treatment is on November 15th. See how that works? So we need a qualifier for boxes 14 and 15. 16, dates patient unable to work. 17 is the name of the referring provider or other source. There's been a change to box 17. Old form, name of referring. New form, name of referring, but they also want another qualifier. So if another doctor, in this example, Dr. Michael Smith, medical doctor, let's say he's an orthopedist, he refers a patient to you for a consultation. He wants you to evaluate the patient and give him your opinion and advice as to what's happening with the patient. So Dr. Smith, orthopedist, refers you a patient. So in box 17, you're going to use the qualifier DN, which means referring provider, and then put the doctor's name in box 17. And in 17B, in this example, Dr. Michael Smith, you're going to get his NPI number and put it in 17B. Let's keep going. Box 18, hospitalization dates. 19. Okay, little change here. Reserved for local use or additional information. Now, as far as chiropractic goes, you may need to enter date of the x-rays or the date of the part exam. So 19 is that, catch-all box where you could put extra information into it. 20, box 20 is outside lab, yes or no, in the charges. 21, this is the biggest change to the form, in my opinion, box 21. The old form had 4 lines for diagnosis codes, labeled 1 through 4. The new form has 12 lines for diagnosis codes, labeled A through L. So you're going to enter the codes to identify the patient's condition, list no more than 12 ICD-9. Next year when we go to ICD-10, there will be 10 ICD, you will have ICD-10 codes, but no more than 12. You want to report, you always want to report your codes to the highest level of specificity. Don't put the narrative description of the codes, just the numbers. Now, you'll see something here in box 21. It's called the Icd Indicator box. It's right here, the Icd Indicator box. So if you're using ICD-9 codes, you put the number 9 in there. Next year, when we transfer over to ICD-10, you're going to put the number 0 in there. There's only room for 1 digit, so we can't put the number 10 in there. You're going to put the number 0 in there next year, not now. So right now, you're going to use the number 9 and ICD-9 codes. This is a big change. This is huge. So what I've done is I've put together one clinical example so you could see how this is going to change. So here's the example. Patient comes in with a headache on the right side for 2 days. The headache is always on one side. Sometimes the patient cannot think clearly. No aura symptoms. Tylenol helps. Massage helps. Patient also has neck pain. Neck pain scale is 7 out of 10, feels it 65% of the day. The patient brought in x-rays. The x-rays show disc degeneration at C5, C6, and a reduced cervical curve. Your exam shows spasm at C1, C2, and C5, C6, and cervical subluxation at C1, C5, and C6. So here are the diagnosis codes. Migraine headache, 346.10. Please make sure you know the difference between a migraine headache and a tension headache. Like a migraine headache is an autonomic nervous system disorder. It usually occurs on one side. Patient can't think clearly. Patient gets confusing thoughts, you know. So that's migraine headache. Aura, you should know what the difference is. Well, you should know if the patient has aura symptoms or not. So what's aura? Aura is that perceptual disturbance that occurs before the headache even starts. So the patient might have different, you know, smells and confusing thoughts and can't think clearly. And this is before the headache even occurs. So this patient didn't have any aura symptoms. So 346.10, cervicalgia, 723.1, cervical subluxation, 739.1, 728.85 is your spasm or your muscle hypertonicity. Disc degeneration is 722.4, and the curve reduction or reversal is 737.10. So how would that get placed on the form? There it is. You're going to label this A through F. If it was the old form, you'd only be able to list 4. Because you have room for up to 12, I say list all 6. That's my opinion. Some insurance companies not want that. There's all different rules. Don't just do this because I'm telling you to do it. You have to do this based on what the insurance companies want. Just giving you the basics here. If an insurance company can't give you a straight answer, then follow my recommendations. That's what I tell all my clients. If you want to get paid by an insurance company, you have to go and find out what their rules are. And we help the doctors find out the rules. Now, sometimes insurance companies are stubborn. They don't give you the rules. They don't tell you what to do. So if that's the case, then just follow my recommendations and you'll be fine. So that's how it goes. There's 6 spots there for box 21. As far as CPT code being attached to this, if you adjusted the patient's cervical spine, so that would be 98940, and then you would put A through F as far as the pointer in 24E. Now, just to give you a little taste, when we go to ICD-10, these are the same diagnosis codes just with ICD-10. So G43.009 is a migraine headache. M54.2 is neck pain in ICD-10. M99.01 is cervical segmental dysfunction. M62.838 is your spasm. M50.32 is your cervical disc degeneration in the mid-region. In ICD-10, there's disc degeneration in the upper cervical, mid-cervical, and lower cervical. And then there's the reverse curve, M40.292. That's why when we go to ICD-10, if you typically use 50 diagnosis codes, you're going to have 150. It's about 3 times as many once you go to ICD-10, just because there's more choices. Like I said, with cervical disc degeneration in ICD-9, there's one choice, 722.4. In ICD-10, there are 3 choices. So that's why you're going to have a longer list. You're going to have a bigger menu. Box 22, resubmission code. If you've never filled that out, don't fill it out now just because we have a new form. 23, prior authorization number. 24A is the date of service. 24B, just a little reminder, there are different numbers based on the place of service. If the service is done in your office, it's the number 11. If you do a home visit, you're going to have to put the number 12 in 24B. If you go to the patient's place of employment, it's 18. Nursing facility, assisted living facility, it's 32. So there's many different place of service codes. Be aware of those. 24C, leave blank. 24D is your CPD codes and HCPCS codes, and there is room for 4 modifiers in 24D. 24E is your pointer. So with the old form, you were doing 1, 2, 3, 4 or 1-4. With the new form, it's going to be A, B, C, D, or you're going to use a range. 24F are your charges. 24G is the number of units. 24H, leave blank. 24I, you could leave blank. 24J is your NPI number. 25 is your tax ID number or your Social Security number. 26 is the patient's your own internal account number. 1, 2, 3, 4, A, B, C, D, X, Y, Z, whatever you use as your patient account number, that's in 26. 27, do you want the checks to come to you? If yes, check yes. If you are a cash practice and the patient's paying you and you want the insurance company to send the check to the patient, then check no to box 27. 28, the total charge. 29 is the amount paid. 30, we have a change here. 30, the old form said balance due. The new form, reserved for NUCC use. So leave 30 blank. 31, doctor's name, add the DC at the end, or you could put signature on file. Whatever you've been using, like if you've been using your name, I'm saying signature on file could pass. Don't switch. Whatever you've been using up until now, as long as it's working, don't change anything. So 31, doctor's name. Sometimes you can get away with signature on file. You want to designate the degrees. Don't just put John Smith. Put Dr. John Smith or John Smith, DC. 32 is the service facility location information. 33 is the billing provider info, name, address, phone number. In 33A, going to put the provider's individual NPI number, or if you are a group, you want to put the group NPI number in 33A. And that's the form. So just a few closing comments. You must check with all the carriers you bill prior to submitting claims based on this information. We cannot guarantee that the information provided in this presentation is going to guarantee payment from any insurance carrier or patient. We're not responsible for any insurance carrier or managed care laws, rules, regulations that may change. So understand that these rules change all the time. So do your best to stay on top of these changes by attending great free webinars put on by Discount Medical Supplies, attend seminars, join your national and state professional associations.